Hello, healthy greetings from the Department of Nutrition and Dietetics, Symbiosis Institute of Health Sciences. Today, I'll be talking to you about nutrition care for home isolated COVID-19 patients. COVID-19 infection impact respiratory tract and it leads to breathing difficulties, associated complications, morbidity and mortality in infected patients. Morbidity and mortality rates are higher in people with comorbid conditions. Now, let me tell you, people with diabetes mellitus, cardiovascular diseases, kidney diseases, and other immune compromised conditions such as cancers, HIV, and in elderly, the severity of the disease is higher. That means we need to be careful. I talked to you about life cycle and COVID infection today, and as you all know, in children, COVID-19 usually remains mild. God willing, we don't have another pandemic that affects children. Adults who are in isolation or in mild to moderate COVID-19 infection are treated at home. Vaccination certainly reduces the severity of this infection. Older adults are at high risk due to complications of higher prevalence of comorbidities observed in geriatric patients, aging associated changes in body composition with gradual loss of skeletal muscle mass and function, which is known as sarcopenia. Additional factors including oral and chewing problems, psychosocial issues, cognitive impairments, and low financial income. That means that we should take care of them appropriately if they are isolated with mild to moderate COVID conditions. Now, today's session will focus on providing insights to the nutrition care of COVID-19 in home isolated patients. Guidelines for home isolated COVID-19 patients. The nutrition goals include the following. The first and foremost is, regardless of the age, appropriate nutrition care is essential. There are two components that we should consider when we talk about nutrition care. That is, nutritional assessment coupled with treatment. Now, adequate nutrition care is shown to be effective in reducing the complications of this disease. Nutritional assessment is primarily conducted to assess the risk of malnutrition and the severity of the same. The goal of nutrition care for COVID-19 patients include preserving the nutrition status and preventing and treating malnutrition to reduce complications. Nutrition support to be prescribed to all patients at their interaction with the healthcare professionals. So let us see what are the dietary modifications for home isolated patients. Let me tell you, we should eat well-balanced diet and keep them hydrated. Patients with comorbidities should modify their diets accordingly to prevent the complications and progress of the disease. Also, it is important to eat a variety of fresh and unprocessed foods every day to get adequate amount of vitamins, minerals, dietary fiber, protein and antioxidants that your body needs. Why do you require them? Because they are the building blocks of immunity which helps your body to fight against COVID-19 infection. Additionally, you need to drink enough water. Avoid sugar, fat, salt-rich foods to significantly lower your risk of overweight, obesity, heart disease, stroke, diabetes, and certain types of cancer. Small frequent meals may suit better than large meals during these conditions. It is important to ensure adequate nutrient intakes based on the stage of life and comorbidities. Nutrition counseling from an experienced dietitian should be taken. You need to modify your energy intakes accordingly. For example, An elderly with polymorbid conditions who is greater than 65 years of age, 27 kilocalories per kilogram body weight per day should be used as a criteria. For example, if the elderly is 60 kilogram, the intake of energy should be adjusted to 1620 kilocalories per day. Elderly with polymorbid and underweight conditions, predominantly our elderly belong to this stage, we should ensure that they get around 30 kilocalories per kilogram body weight per day as energy requirement. Energy intakes to be individually adjusted, and it should be based on their nutrition status and physical activity. How about the protein needs? As we know, COVID-19 infections increases the intake or the requirement of protein. Elderly is no different from this scenario. Elderly people requires 1 gram per kilogram body weight per day, and this should be again adjusted to the nutrition status, the disease status, physical activity and the tolerance level. People with multiple morbid conditions, especially in the inpatient scenario, we should prevent body weight loss, reduce the risk of complications, hospital readmission and other challenges that could arise by giving them greater than 1 gram protein per kilogram body weight. Fat and carbohydrate also needs to be adjusted according to the requirement, and normally we say 30 to 70 ratio for people with respiratory challenges. The most important aspect is to ensure sufficient supplementation with vitamins and minerals. Low levels of intakes of micronutrients, especially that of vitamin A, D, E, B6, B12, zinc and selenium has been associated with adverse clinical outcomes during viral infections. So what does this mean? It means that we need to supplement or ensure adequate provision of vitamins and reduce the negative impact of this infection. There is a popular saying that goes, a multivitamin, multimineral supplement for malnourished people, and COVID-19 patients are no different from this. There is no evidence for additional benefits of mega doses of micronutrients in patients. In fact, as a nutritionist, I advise we should refrain from doing so. Whenever there is a need, that means when the dietary counseling and food fortification are not sufficient to ensure the dietary intakes, we should think of providing oral nutrition supplements. Oral nutrition supplements should be used wherever possible to meet a patient's needs, not to overdose them. This is something important we should learn. The levels of nutrients should not be greater than the recommended daily allowances of these micronutrients. It is important to maintain regular physical activity. Patients in quarantine, home isolation should continue regular physical activity while taking precautions depending on the severity of the disease. Home quarantine can lead to increased risk for potential worsening of chronic health conditions. For example, some patients you will see they gain weight, they lose skeletal muscle mass and strength, possibly due to inactivity, and loss of immune competence is also an outcome of home quarantine. It is important to do regular physical activity, and it is no different for home isolated patients depending on their tolerance. Let's take a quick quiz now. Let me ask you the quiz. Please identify the correct answer. The first step in the nutrition care for individuals at risk of COVID-19 is The options are assessing their nutritional status, providing nutrition tips, understanding their eating pattern, and prepare them for enteral feeding. Guess the answer? Keep it ready. I will ask you towards the end of this session. Let's take the next quiz. Which group from the following list has a higher risk of complications from COVID-19? Pediatric, adult women, geriatrics or adolescents? I hope you know the answer right now. Hold on, we take it towards the end. If you need a break, this is time for your break. Have 10 minutes activity break, have healthy time, then come back to me. We will take you through the remaining part of this course. I hope you had a quick break. Now I take you through the intricacies of our dietary requirements and the nutrition care. I told you that we should eat fruits, vegetables, legumes, nuts and whole grains and foods from animal sources to provide more of protein. Now, this is something very important from the point of view of COVID-19 patients. Daily, we need to eat 2 cups of fruits, that means it is of 4 servings, 2.5 cups of vegetables, that means 5 servings, 180 gram of grains, 160 gram of meat and beans. Now, let me tell you, you can take meat, poultry and all 1 to 2 times per week. Please don't use them regularly. It is better to have a combination of protein from plant and animal sources. If you want to have some snacks, choose raw vegetables, raw fresh fruits rather than foods that are high in salt, sugar and fat. Do not overcook vegetables, fruits, as this can lead to the loss of important vitamins and minerals. It is important to ensure adequate intake of fiber, and there are multiple fiber-rich foods available including vegetables, fruits, whole grains, pulses. Include them in each meal and ensure that you are consuming it on a regular basis. And this helps in the appropriate functioning of the digestive system, and this is something important to take care during COVID-19 infection. Drink enough water every day. Water is essential for life. At least 8 to 10 cups of water is important. Be careful not to consume too much of caffeine and avoid sweetened fruit juices, syrups, fruit juice concentrates, fizzy and still drinks as they contain a lot of sugar. A clear no to the soft drinks and sweetened beverages. Eat moderate amounts of fat and oil. This is important because WHO recommends limiting total fat intake less than 30% of total energy intake, of which no more than 10% of fat should come from saturated fat. How do we achieve this? There are a few tips I can give you which you can try it at home. Opt for cooking methods that require less or no fat, such as steaming, grilling, sautéing instead of frying foods. If needed, use small amounts of olive or sunflower oil to cook foods. Prefer foods that contain healthy sources of unsaturated fats such as fish, nuts. Consume unsaturated fats rather than saturated fats. Choose white meat and fish which generally are low in fat rather than red meat. You should think of limiting saturated fats from the meat and meat products by trimming the excess fat from them, and choose skinless options as far as possible. Reduce foods such as red and fatty meats, butter and full fat dairy products, palm oil, coconut oil and solid shortening and lard. Avoid processed meats because they are high in fat and salt. Wherever possible, opt for low-fat, reduced-fat versions of milk and dairy products. Avoid industrially processed trans fats. Why we should contain these trans fats? Because these are abundantly found in processed foods, fast foods, snack foods, fried foods, frozen pizza, pies, cookies, margarines and spreads. How do we know whether there is presence of trans food? Read the nutrition labels. It is important to ensure that partially hydrogenated oils are not listed in the ingredients. If in doubt, use always minimally processed foods and ingredients are better choice. Important to follow the next tip, which is a bit difficult. Eat less salt and sugar. It is very hard, isn't it? But it is very important to contain this urge for salt and sugar, especially in case of COVID-19 conditions and those with comorbidities such as hypertension, diabetes, cardiovascular disease. You should watch out that you are not consuming more than 5 grams of salt a day, and that means approximately 1 teaspoon. And whenever you are using salt, please use iodized salt. Choose fresh fruits instead of sweet snacks such as cookies, cakes and chocolates. Let me tell you, it doesn't mean that I don't go out, you shouldn't go out, but it is better to avoid eating out. Eat at home to reduce your rate of contact with other people and lower your chance of being exposed to COVID-19 during recovery. Maintain at least 1 meter distance between yourself and anyone who is coughing or sneezing, which is not always possible in a crowded condition, especially in the social settings of restaurants and cafes. Why should we maintain this distance? The droplets from the infected people may land on the surfaces and people's hands, and the customers and staff are no different. With lots of people coming in and going, you cannot tell if hands are being washed regularly enough and the surfaces are being cleaned and disinfected fast enough. Advice: avoid eating out. COVID-19 infection and the home isolation often makes a person depressed. While maintaining appropriate nutrition and hydration, it is important that we are mentally healthy, and adequate diet and good health is something important when your mind is healthy. Seeking counseling and psychosocial support from appropriately trained healthcare professionals is important during this phase. And this will help you to cope with isolation and the recovery stage if needed. Avoid alcohol or at least reduce your alcohol consumption. All of us know that alcohol is not only a mind-altering and dependence-producing substance, it's harmful at any level consumed, but it is also weakens the immune system. Thus, alcohol use, especially the heavy use, undermines your body's ability to cope with infectious disease, including COVID-19. Beware, limit your alcohol intake. It is important to follow safe food handling practices. Food safety is a prerequisite, and only safe food is healthy food. When preparing food for yourself and others, it is important to follow good food hygiene practices to avoid food contamination and foodborne diseases. The 5 key principles of good food hygiene include: keep your hands kitchen and utensils clean. Separate raw and cooked food, especially raw meat and fresh produce. Cook your food thoroughly. This is something very important, especially to avoid foodborne infections. Keep your food safe at temperatures either below 5 degrees or above 60 degrees, and use safe water and raw material. It's very important to follow these guidelines. Reinfection could be detrimental to your health. People who stay alone or they are away from their family members can take the advantage of food delivery options. While I say this, let me reiterate that home cooked meals should be prioritized. As far as possible, please use the home cooked meals. However, in certain conditions, you may be forced to order food items. In those conditions, use contactless options where no human interaction is required, and you can get the food delivered to you by appropriate food handling or food delivery systems while you are on a self-quarantine or isolation. For food delivery and transportation, it is important to keep food safe at temperatures below 5 degrees centigrade or above 60 degrees centigrade. Often people wonder, what should I do when I have some problems while I am isolated or in a self-quarantine condition? For example, if you have poor appetite, fatigue or feeling full quickly, there are some nutrition tips that I can give you to help you with this condition. For example, you could think of eating small frequent meals 4 to 6 times per day or eat every couple of hours. Eat foods high in protein first and then eat the rest of it. This will ensure that you get adequate amount of protein in your diet while you are not compromising on other aspects. Eat high calorie and high protein foods at meal times. Eat high calorie and high protein foods. For example, you could use cheese, you could use dals, you could use egg, milk. If you can't eat food, take at least a milkshake so that it ensures that you get some amount of protein and carbohydrate that will help you to recover from your disease. Drink milkshakes or milk replacements such as protein drinks in between the meals. Consider a multivitamin supplement if you are not eating well enough. That means if you are not eating greater than 50% of your normal intake, make sure you consume a multivitamin, multimineral supplement to improve the intakes of these nutrients. I reiterate, multivitamins and multiminerals supplements actually help you provide more than what you require often, and that actually helps to build in immunity against infections. Now some of you may think, oh, I have taste changes. What do we do? In that kind of scenario, I suggest a few tips for you. Eat foods that are bland to start and then add flavor. Then you are able to feel the taste towards the later part of your meal. Try colder foods to start, since hot foods can have very strong taste. Add little amount of sugar, salt or seasonings to flavor your food. Remember, too much of salt and sugar is not good for you. Use sour candies, mints or gum before and after the meals if your mouth is too dry. Brush your teeth regularly. If you have difficulties in swallowing, follow the dietary modifications your dietitian would suggest at the time of the care, or you could call them and connect with them to get additional support. What I told you this entire time was about how we treat or how we support the patients with nutritional care when you are isolated at home with mild to moderate COVID-19. What I am going to tell you now is, to a person who is discharged from the hospital setting and come back home, what should you do? When you are back from the hospital, it is quite natural to feel weak or tired to eat, and you may have lost some weight as well. You also might be eating and drinking less than what you used to before you got sick. This is absolutely natural, not to worry about this. How can you improve your scenario? You need to eat fresh foods and foods that are rich in protein at each meal, and make sure you have it in every meal that you consume. Also, make sure that you can eat whole grain foods, pulses, and carbohydrate foods that will give you some amount of energy. Try to eat vegetables and fruits at each meal. Make sure you are eating salads and whole fruits rather than choosing fruit juices. It is also important to monitor what you consume. Imagine you are eating very poorly. You should note it down, saying that you have taken 0%, 25%, 50% or 100% of your meal. This would help you to monitor your intake. Now, why should you monitor? It is very important to identify people who are not eating well. That means if a person is eating less than 50% of what he or she should consume, they should consider oral nutrition supplement, or they should replace those meals with something. For example, as I mentioned earlier, the milkshakes to improve their intake, some liquid or semi-liquid foods that can fill in the energy requirement, and similarly the other nutrient requirements such as protein, vitamins, minerals and water. This is very important. Recovery phase is a phase where you need to consume adequate amount of nutrients so that you can get over the disease, come back to your normal stage. Now, it is time to give you answers for your quiz. I hope you know the answers. The first step in COVID care is to assess the nutritional status of the person, identify whether the person is malnourished or normal. The second question answer is, the COVID influences geriatrics very badly due to obvious reasons which I mentioned during my sessions. I hope you have gathered enough information about the life cycle nutrition and COVID-19. Now, the purpose of these quizzes are, some of those sections what we have covered may require additional explanation, and I have planned these quizzes to address these explanations so that you learn by this question answer kind of a mode. Have a break. We come back in 10 minutes time. Welcome back to the sections. We discussed about 2 questions which I gave you earlier. Now we move forward with the rest of these quizzes. So it's quiz time, my friends. From the following list, identify the foods that improve body immunity against infections. I give you 5 seconds. Please go through the list and identify your answer. Hope you got the right one. Did you think it is junk and fast foods? Tell me, what do you mean by junk and fast foods? They are the foods rich in empty calories. That means they provide only calories without any other nutrients. So, do they help you against infections? Not certainly. Refined sugars and sugary drinks, they also don't help you because you learned in your session that we should reduce the use of salt, sugar, and fat because they don't help you with immunity. Vegetables and fruits are the right options because they provide you with adequate amounts of vitamins and some of the minerals which are very essential for building immunity. The last option, high fat, salt, sugar foods, is wrong again. As you all know, we should reduce the intake of salt, sugar, and fat to improve the immunity. I hope this is clear to you. The next quiz that's on your screen is anti-infective vitamin is. You are given with the following options of vitamin C, vitamin B, vitamin A, and vitamin D. Can you identify the right one? I give you 5 seconds. Hope you have identified. The right answer here is vitamin A. Vitamin A is known to fight against viruses, bacteria, and other pathogenic organisms through providing or improving the immunity of the body. When people are deficient in vitamin A, they have a higher risk for infectious diseases. Now, what about the other vitamins here? Even you might have heard that vitamin C helps you to fight against common cold. Now, vitamin C is a powerful antioxidant, and that is the reason we attribute to and its powerful nature of destroying pathogen. But vitamin A is considered as anti-infective because it boosts the immunity of the body. Let's move on to the next one. Mega doses of vitamins and minerals are useful to improve immunity. The assumption is you have to say whether this is true, false, or true for all vitamins and true for all minerals. What do you think? I come back to you in 5 seconds. This statement or the assumption is false. Many a times you will see that people throng the medical shops or online. They order multiple supplements, especially during COVID-19 time. You will see that there have been multiple reports about excessive use of these vitamins to improve their immunity against the disease. But this is false. Any nutrient should be consumed within the requirement, which is known as recommended dietary allowances. Consumption of these nutrients, especially vitamins and minerals, above than what is required for the body can lead to toxicity condition. When you have toxic situation in the body or toxicity conditions in your body, that can adversely affect your system. So beware, please don't consume too much of supplements. Supplements are needed only when you are malnourished and you are not able to consume regular amounts of the different components of balanced diet. Let's move forward. Oral nutritional supplements should be used for patients when there are 4 statements here. When patients are normal, dietary counseling and fortification are not sufficient, there is adequate amount of food intake, services of a dietitian are available. So, what is your option? I will come back to you in 5 seconds. Hope you have identified the right one. So, normally, oral nutrition supplements are advised when there is a lack of availability of a dietitian to counsel a patient, and also when fortification of foods are insufficient. That means your dietary intakes are insufficient to meet your requirements, hence you require additional nutrients through supplements. Now, what is fortification? Fortification is addition of specific nutrients to increase the nutritive value of those foods. For example, we have wheat flours that are fortified with vitamin B12, folic acid and iron that are available in the market. Why do we fortify them? Because majority of our Indian population, you will see that they are deficient in these micronutrients, and hence to improve their nutritional status, Government of India has allowed the permissible limits of these nutrients added to these foods so that consumption or intakes can be increased by the regular use of these foods. Whereas when you have a service of the dietitian available, you can always consult and modify your diet accordingly so that you can increase the availability of these micronutrients. I hope this is clear to you. Let's move on to the next question. Following are the methods to reduce fat consumption, except, remember, I am asking for one option that doesn't belong in there. Use of red meat over white meat, use of white meat and freshwater fishes, use of processed meat and products, use of hydrogenated fats instead of oils. Please read it carefully. I'll come back to you in 5 seconds. Okay, the answer is use of red meat over white meat, which is actually not a method to reduce the fat intake in the diet, whereas all the other 3 options are related to the methods which you could use to reduce your fat intake. Now, use of hydrogenated fats instead of oil is not a good option. What are hydrogenated fats? They are the fats which contain higher amounts of saturated fatty acids. For example, your vanaspati, dalda, these are examples of hydrogenated fats, and they should be used in very small quantities. I hope this is clear to you all. Okay, let's move on to the next one. Following are the methods to reduce salt intake, except less use of snacks, less use of processed foods, use of natural preservatives in the foods, use of table salt instead of salt added during cooking. Identify the right one. I will come back to you in 5 seconds. Hello, you all identified the right one? The answer is use of table salt instead of salt added during cooking. Now, why do we say this? When we add salt during consumption at the table, often there is a tendency to add more than what is required. And naturally, the intake of salt increases over and above what you can add during the cooking process. So friends, it's important to reduce the consumption of salt, and it's important to consume low salt diet to reduce the risk of diseases. We move on to the next question. Safe food handling and hygiene practices include all the following, except keeping hands, kitchen utensils clean, separate raw and cooked food, especially raw meat and fresh produce, cooking food thoroughly, keeping food at above 5 degrees centigrade or below 60 degrees centigrade. Identify the right one from the list. Thank you. I hope you identified your answer. The answer is keeping food at above 5 degrees centigrade or below 60 degrees centigrade. Why is that I say this is a false answer? Primarily because this is the ideal range where microorganisms grow and multiply. That means we should always keep foods either below 5 degree, that means in a refrigerated condition, or above 60 degrees centigrade, that means in a warm condition. This is important. We move on to the next quiz. If you have any doubt, please let me know. I can connect back with you. The following are options to improve food intake during COVID-19 conditions, except the 4 options in front of you are: eat small frequent meals 4 to 6 times per day, eat foods low in protein first at meal times, drink milkshakes or meal replacements or protein drinks between meals, use of multivitamin supplements if food intake is not adequate. I'll give you 5 seconds and I'll come back to you. I hope you have identified your correct answer. The answer is eat foods low in protein first at meal times. Why is this answer wrong? Because we should eat high protein foods first at meal times, especially when you are having COVID-19 disease. Proteins are essential to improve your immunity, and the immunoglobulins and many other proteins that are related to that produce immunity in your body are composed of proteins. So naturally, a diet containing adequate amounts of protein during COVID-19 is very essential. And that is the reason we advocated the use of milkshakes or meal replacements or protein drinks between meals is good during the kind of scenario we are going through, especially when a person is diagnosed of COVID-19 disease. Okay, I hope you are learning along with me and you are understanding the concepts with much more clarity. Let's move forward with a few more questions. The following foods are high in protein except fish, egg, poultry, butter. I give you 5 seconds. Please identify the right answer. I hope you got the answer. Answer is butter. Butter is rich in fat but very limited in protein. So, what you need to consume is fish, egg and poultry in adequate amounts rather than too high amounts, and a combination of protein from plant foods and animal foods is much better than any one type. And I would recommend as a nutritionist that you need to have a combination so that you get enough amounts of protein to build your immunity. Now let's move on with the other question. Select the whole grain food from the following list. Please identify the one that is correct. Maida, which is otherwise known as American flour, cornflakes, brown rice, white rice? 5 seconds, identify your answer. I hope you identified the answer correctly. The answer here is brown rice. Now, why brown rice? Brown rice has its coverings intact. Although the husk is removed, the inner coverings are intact, which means they contain good amount of fiber and it is wholesome compared to maida, white rice and cornflakes. White rice is the rice that is devoid of the outer coverings, and that takes away all the vitamins that is required for your body, and that is why brown rice is much more wholesome compared to white rice, cornflakes and maida. Moving on, can you identify a rich source of vitamin C from the following? Amla, apple, pineapple, banana. I hope you have identified the right answer as amla, which is a very simple question. Apple, pineapple and banana don't have high levels of vitamin C, but amla is a very powerful and rich source of vitamin C, and you will see that often amla is part of many of the Ayurvedic medicines, and it is supposed to improve immunity against diseases. So, I hope you are enjoying this quiz session and you are learning more than what you have learned during the session. Now, let's move on to the next question, that is, zinc is important in improving immunity. True or false? 5 seconds. The answer is true. Zinc is a very important trace element that is required for immunity, and it is a true statement. Now, friends, I hope you are learning along with me. You might be thinking, there are so many nutrients available, and then which one is more important compared to the other? Well, my friends, let me tell you, micronutrients, no matter what it is, all of them have its own functions to deliver, but their requirements are very small. That is why we call them micronutrients. Now, within this micronutrients, you have vitamins and minerals. Some of these vitamins are water soluble in nature, whereas some of them are fat soluble in nature. That means if you consume too much of fat soluble vitamins, they cannot be removed from the body, whereas water soluble vitamins can be easily excreted out through urine. So that means we need to be extra careful with the mega doses of many of these micronutrients, because it could lead to toxic conditions. Now, let's move to the next quiz. Can micronutrient supplementation prevent COVID-19 in healthy individuals or cure it in patients with COVID-19 disease? Tell me whether it is true or false, or if you are not sure, you can mark so. I hope you have identified the answer. The answer is no. Micronutrient supplementation cannot prevent COVID-19 in healthy individuals or cure it in patients with COVID-19 disease. There is still not enough evidence of these in prevention or cure, but yes, if you are inadequate in nutrition status, if you are malnourished and you have a deficiency of vitamins or minerals, that can actually increase the severity and complications of these diseases. So this is why it is important to understand adequate amounts of nutrients are required in the body to fight against infections, but too much or too little can be harmful. The next question is, Are there any herbal teas, herbal supplements that may help prevent or cure COVID-19? Identify your answer. I hope you identified the answer as no. We do not have any such herbal teas or herbal supplements that may prevent or cure COVID-19. It's important to understand this before you start using too many of these supplements and herbal teas. Now let's move forward with the other questions in this list. Many of the times people think that our spices are very powerful and they can prevent COVID-19. So my question is, can eating ginger help prevent COVID-19? Please identify the answer. Now the answer is no, ginger cannot prevent COVID-19. Can adding pepper to your soup or other meals help prevent or cure COVID-19? Think about it and answer. The answer is no. Adding pepper doesn't help in preventing or curing COVID-19. Now let me ask you some general questions. Let's have a discussion. What foods should be consumed to support immune system? Take 5 seconds and write it down on your note. Okay, the immune system requires the support of many nutrients. There are not one or two, but they require multiple nutrients. So, it is recommended to consume a variety of foods for healthy and balanced diet, including whole grains, legumes, vegetables, fruits, nuts, and animal source foods. There is no single food that will prevent you from catching COVID-19. Friends, I hope you are more clear about what we want to communicate to you in terms of the use of foods that would support immune system. Next question is it safe to have groceries delivered? At this time of pandemic, many of us worry about going out. So what is the option? Can it get delivered at home? Yes, it is safe to have groceries delivered if the provider follows good personal and food hygiene practices, which we discussed during our session. After accepting food or grocery deliveries, please wash your hands. This is very important to prevent infection. Now, the next question is, can the virus that causes COVID-19 be transmitted through the consumption of cooked foods, including animal products? Take a reflection of what we have learned and let's answer this. Okay, let me tell you the answer now. I hope you have identified the correct answer. There is currently no evidence that people can catch COVID-19 from food. Viruses that causes COVID-19 can be killed at temperatures similar to that of other known viruses and bacteria found in food. Foods such as meat, poultry, eggs should always be thoroughly cooked to at least 70 degrees centigrade, and before cooking, raw animal products should be handled with care to avoid cross-contamination with cooked foods. So this is something important to ensure safe food handling practices, and it is important to follow these so that cross-contamination of foods can be avoided to prevent COVID-19. The last quiz I have for you in this session is, how should I wash fruits and vegetables in the time of COVID-19? Now, reflect on this. We'll come back. Okay, let me answer you then. I hope you have written the similar answers. Wash fruit and vegetables the same way you would in any other circumstance. Before handling them, wash your hands with soap and water. Then wash fruits and vegetables thoroughly with clean water, especially if you eat them raw. This can actually prevent the contamination of yourself. Specifically, when you don't follow hygienic practices, you have a higher risk for COVID-19. I hope this has been a helpful session for you. Any queries, please feel free to connect with us. This has been helpful to you to understand the nutritional care for people at different stages of life cycle. I thank you and healthy greetings. Stay safe, stay healthy.